begin with then, the CQC announced some reforms recently to the way it's going to inspect learning disability homes. Can you tell a bit more about that, and how is that actually going to make a real difference, and how will that not make a difference?
Well, I think it will make a difference. The changes that we've announced around inspection of all of our learning disability services that are in the scope of regulation will fall across the different chief inspectors' functions. So where people are in hospital settings, either NHS hospitals or independent hospital settings, those services will be inspected by Professor Sir Mike Richards as part of his hospital inspection responsibilities. And as he has done with the acute hospital services, those inspections will include a bigger team. So we'll be moving from somehow a single pursuit around all of this to a team sport around those inspections. We'll have experts by experience, that is people who've used those hospital services, family members, and a range of professionals, so current serving professionals in those sectors joining those inspection teams. So that will give us a much broader but also in-depth component and make the analysis and the judgments, we think, much more robust. When it comes to the adult care sector, we announced in the document, the signposting document launched recently called A Fresh Start, that we'd be looking at the methods for inspecting services for people with a learning disability in those adult care and community placements. And again, the intention there is to inspect those services always with a default of including experts by experience, that is people who've used those services and have very recent experience of using those services, or maybe current users of those services. Families who will be fundamental and critical to this. And again, we will increasingly take professionals with us to support those inspections and the judgments that we'll make. And where those services are part of larger corporate organisations, again, we'll be looking at the leadership, the governance arrangements that those organisations have around quality and safety. That isn't to say we won't do that with smaller organisations, of course we will, but it will be proportionate to the size of the services that we inspect. And I should say as well that because primary medical services are also in the scope of regulation for us, our Chief Inspector of Primary Medical Services, Professor Steve Field, is also committed to looking at the extent to which GPs and GP services and their practices will respond to the needs of people in regard to their healthcare requirements, people with learning disabilities in regard to their healthcare requirements in their local communities, and indeed where the care home sector is reliant on local GP services to come in and provide that healthcare. We'll be looking at those arrangements as well. So I would say it's going to be a pretty comprehensive approach to all of this, pulling in the best of what we've done previously, but expanding the nature and the role of those teams to ensure that we can make robust assessments and judgments.
Yeah, and there's going to be, you're going to have more teeth as well to take action quickly if you find the services are failing.
Yes, we will. We're waiting for the department to launch what will be called the fundamental standards of care. So the current regulations that we inspect our services against, will be gone by next year. The department will consult on these fundamental standards, and where we find that providers, either hospital services, primary medical services or adult care services, fall short or breach those fundamental standards of care, we'll be able to take immediate enforcement action. We will not need to go through a process where we have to issue warning notices, giving the provider time to respond. We'll be able to take immediate action to protect the safety and the quality of care for people who we know in many of these circumstances are made much more vulnerable.